Now, for more on this topic as well, we are now joined by one of the world's leading pandemic management experts, the CEO of health tech firm Energesse, Dr. Avnesh Ratnanesn. Doctor, thank you so much for your time.
Thank you. Thank you for the invitation to be here.
Now, you have advised senior health government officials right around the world. Can you just give us a little bit of background how exactly you've helped to, improve dealing with risk in health settings?
Yeah, absolutely, Holly. So we're Energesse, a leading digital health company. We, during the pandemic, developed a digital health solution to actually help hospitals, healthcare facilities in these vulnerable populations, but also in working with governments, identify risk much quicker than we've done in the past, but also help advise frontliners through the use of this tool as to what the right information and what the right protocols are in order to get on top of these risks very quickly. We won an award from the International Hospital Federation, which is the global organization that assesses how hospitals respond to the risk, and they presented us with an award regarding it as an international best practice globally.
Yeah, incredible. So I guess pretty much most of Australia has been thrown into some form of lockdown again at the moment. In your opinion, where do you think Australia is going wrong when it comes to managing the virus?
Well, certainly when we look at how Australia has responded up to now, we've been regarded globally as one of the countries that has been a star performer. Having said that, now we are in a situation where we've got certainly 4 states in a lockdown scenario of some form. And the big reason for this is because we anticipated to a certain degree that the virus will mutate over time. Now, what we didn't know is how quickly and how more virulent or contagious the current Delta strain is. And that's now resulting in these ongoing outbreaks because we are reacting to outbreaks after they occur. We're trying to clamp down on them with contact tracing and so on after the fact or after the risk has been unaddressed. And what we need to do moving forward is actually get on top of these risks and manage them proactively using technology.
Yeah, so lockdowns are costly on our mental health, economically, businesses going under. We know that people are really struggling here. So you're saying that basically lockdowns are not the answer, but instead to use tech to be on the forefront?
I think there's multiple measures, and in some situations they might be the only solution, but there are multiple measures that we need to put in place, not just lockdowns or contact tracing, but we need to address the risks that are occurring in different scenarios. Let's take the Sydney lockdown, for instance, or the outbreak rather, that has occurred. When we think about the limousine driver that was driving that day, who perhaps didn't put in place all the protocols that was required, such as the appropriate masking or being vaccinated, despite working in a high-risk setting. These protocols and guidelines are changing almost daily. It is actually humanly impossible to actually keep up with all these guidelines for any person at the moment, unless we have technologies that actually tell us what the right thing to do is at the right time in order for us to apply this. So we need to be looking more towards the future and how can we avoid this billion-dollar-a-week lockdowns by using and investing in the right technology to give us the right information at the right time.
Yeah, I definitely agree with you. There's so much mixed messaging around vaccines at the moment. And I guess the continued change of advice, we've just been speaking about the AstraZeneca vaccine and the change of advice there. In your opinion, how much does this affect the confidence in our government, but also in the vaccine?
Yeah, look, certainly, what communities want and what the public wants is certainty, right? So they certainly want consistency of messaging. They certainly want confidence in their governments and in the therapies that are being prescribed in order to help them. The reality is the situation is changing every day and that the protocols keep changing because if you look at last year alone, there were 200,000 plus publications on COVID. So the information keeps changing so rapidly that the guidelines need to be keep updated. And what we need to do is become a very agile scenario, and in particularly high-risk facilities, such as our aged care centers, such as our quarantine facilities, and our hospitals, we need to achieve a level of hyper-compliance. We need to actually be able to be on top of these guidelines very, very quickly, and that's where we need to use technologies such as the ones we've developed today.
Absolutely. Now, you have been in discussion with health and government officials right across the country and the world on their coronavirus response in regards to your business and what you believe is the solution. Are they listening to you?
Well, certainly we're in protracted conversations in certain states, and officials are listening, particularly those in Victoria and South Australia that we've already begun significant conversations with stakeholders there. Having said that, health officials are often torn or having to juggle multiple competing priorities in dealing with the outbreak of today versus putting in place improvements in order to implement how we improve our response to outbreaks in future. And they're constantly struggling in that space. So one of the things that we're doing, Holly, is helping these government officials to stay on track, to focus, to actually not just deal with the immediate emergency of today, but to actually invest time and resources to protect our nation for the future. And that is putting in place the right technology solutions and infrastructure such that these improvements actually occur and we can prevent lockdowns in future and prevent some of these outbreaks in future.
Yeah, indeed. Doctor, lastly, before we wrap things up, what would you like to see in the weeks ahead? As I said before, most of Australia has been plunged back into lockdowns again. What sort of steps would you like to see in the immediate future, in the week ahead, 2 weeks' time?
Well, certainly, I think communities and the public want to see the government looking at new approaches and different approaches on how we solve these new viral strains, but also taking different approaches to potentially preventing these lockdowns from occurring and preventing these outbreaks from occurring in the future. And that requires getting on top of these risks, particularly risks that are occurring in high-risk facilities and with high-risk individuals that are working in sites such as hospitals where COVID is prevalent, such as when we're transporting passengers from quarantine facilities and so on. We need to have better focus in these areas. And in the months to weeks ahead, I certainly believe that the public wants to see more assurance that these risks are being addressed and more preventative measures are being put in place.
Indeed. Doctor, thank you so much for taking the time to come on Ticker. It's been a pleasure to speak with you.
Thank you so much. Appreciate your time.